Hello, hi. My name is Dr. Hitesh Billa. I'm currently working as consultant pulmonologist in Apollo Clinics, Manikonda. Today I would be talking on the commonest lung conditions called as bronchial asthma. See, asthma is a chronic inflammatory lung condition and it is a heterogeneous disease. See, why I'm saying chronic inflammation? There is always some inflammation in the patient's airways which will result in symptoms like number 1, cough, number 2, shortness of breath, number 3, wheeze, number 4, chest tightness. And these symptoms may vary in intensity from person to person over a time, and that depends on the duration of the patient's asthma condition. How to diagnose asthma? Asthma is diagnosed based on the clinical condition as well as there is one test called as spirometry. The test assesses the airway reversibility before and after the use of medication, how the airway is responding to the medication. That will give you a clue about asthma. The asthma diagnosis is confirmed. Now I would like to talk about what are the precautions you should take to prevent an asthma attack, especially during the rainy season or the winter season. Number 1, as I always say, like to my patients, the best option in asthma is always prevention of exposure to the allergens and the irritants whichever is triggering the patient's symptoms. The dust particles or the dust mites, the pollen, fungal mold, and these symptoms can also be worsened by the irritants like the diesel fumes and the indoor dust and outdoor dust, indoor pollutants. These are the common triggers for asthma. So you should always try to avoid the exposure to the allergens. Whenever you're going outside in the mornings, try to wear a mask. It will help you preventing the pollen exposure. Try to minimize the use of indoor irritants as well as the indoor pollutants. Usually we use sambranis or agarbattis at home, which usually gives a trigger to the asthma patients so that the baseline symptoms will always persist. And number 2, I would like to suggest is always when you're using an inhaler, be particular about the technique. So we have a lot of inhalers in the market. The type of inhalers I'm talking about, it can be a rotacaps or it can be a meter dose inhaler or it can be even the nebulizer which generates the aerosol. So rotacaps, you have a capsule, inhaler you have a aerosol spray with the medication, and nebulizer, it generates aerosol with the particular specific medication as prescribed. The technique of inhaler, as I always recommend how to take and what to take, I would teach my patients how to take and how to use an inhaler particularly, and when to take and what to take is actually very much important for an asthma patient to prevent the exacerbations or to reduce the worsening of the symptoms. And number 3, I would like to tell you, which I always advise my patients, like when you're having a lot of comorbidities like the diabetes or the hypertension or underlying lung conditions like the bronchiectasis or any recent or recurrent pneumonias, I would like to recommend you to consider vaccinations for viral pneumonias as well as the bacterial pneumonias. The viral pneumonias include COVID pneumonia or the influenza viral pneumonias, and the bacterial pneumonias include like the pneumococcal vaccination. There are many more precautions that you have to take being an asthmatic, and I would like to suggest to visit your nearest physician or pulmonologist to know more about it. And if you want to know more about asthma, if you want to get treated, or if you want to have my consultation, you can consult online or come to my clinic in Apollo Manikonda. Thank you.